Hi, this is Josh from pharmacisttips.com. Just a little short video here to talk about metformin use for weight loss and discussing whether it's safe to use for the long term. First off, just a real quick metformin overview, what it is. Metformin works in the body by reducing glucose or the sugar made by your liver. Your liver makes a lot of the blood sugar required for use in the body, and so this slows that process down. It increases the glucose used by the muscles, improves glucose sensitivity as by the muscles and other tissue in the body. It decreases the absorption of glucose in the colon. And one of the nice things, it does not affect insulin secretion. So we don't see hypoglycemia or where your blood sugar drops too low and then you have to take some sort of sugar to get it back up and you're on a blood glucose roller coaster. That's one of the nice things about metformin. We don't see that. So let's look at a long-term study. So this long-term study was looking at safety, tolerability, and weight loss associated with metformin. It was shown that it produced weight loss and delayed or even prevented diabetes. Metformin is often used in pre-diabetics, and it can help especially along with lifestyle and dietary changes. It can prevent people from developing type 2 diabetes. It was a double-blind study, meaning it was metformin versus placebo, 7 to 8 year open trial. And again, they were looking at adverse events, tolerability, and the effect of adherence. Adherence means do you take your medicine like you're supposed to? So they did not find any significant safety issues. As a whole, metformin is tolerated pretty well, except right here, gastrointestinal. That means the stomach things. That's why the dose needs to be started slowly, taken with food, and all that to improve the tolerability of your body so you can tolerate this medicine so it can work without all the side effects. So weight loss magnitude was directly related to adherence. So if you don't take the medicine, it's not going to work, basically, is what we're saying. Weight loss was significantly greater in the metformin group than the placebo. And there was a noted reduction in waist circumference in the metformin group as well. So they did note that it was well tolerated and weight loss associated with it, and many people on it 10 years in the study without any significant adverse reactions. Here's another study looking at weight loss that was to evaluate metformin versus a placebo. This is a meta-analysis. That's where they go through and they poke out details from a whole bunch of other studies, so it can give us an idea of trends, but it's not a gold standard by any means. So compared with placebo, people on metformin lost 2.3 kilograms. That's about 5 pounds for you folks here in the US, and compared with the placebo. There wasn't a big difference in the waist circumference, which is too bad. We would like to see that you're also losing some of that midsection girth that's noted to increase your risk of cardiovascular disease and things like that. We like to see the abdominal fat uh, reducing. Then, of course, they noted no hypoglycemia, as we talked about. That's just part of how metformin works in the body. So they determined it is effective at reducing body weight in obese individuals, and it doesn't cause low blood sugar. Here's another one. We're looking at how it uh, the potential ways that it causes weight loss. So we know that it lowers glucose, which fat storage generally occurs when you have high levels of blood sugar and high levels of insulin in the body. That's one of the most common ways that fat gets stored in the body. So if we can keep that average blood glucose down, the body releases less insulin and you have less fat stored. So other mechanisms include a decrease in appetite and unfavorable fat storage conditions. That's where we're talking about low blood sugar, low insulin, less likely to put that weight on. So they also found metformin reduced appetite. And again, it may have something to do with leptin and insulin sensitivity, all things that we'd like to see improve if you're diabetic or obese. It did affect some food intake as well as regulation of fat oxidation and storage in the liver, skeletal muscle, and fat tissue. Again, that's meaning we're seeing increase in insulin sensitivity. Your body can utilize that sugar better. It's not overwhelmed by constantly high levels of sugar in the body. So it has a modest effect on weight loss, especially in obese individuals at risk for diabetes, like a pre-diabetic. Lipids are important because we see that's cholesterol. So we see a lot of people obese or pre-diabetic or diabetic. They're going to have high cholesterol. And that's also, when you're diabetic, it puts you at high risk of heart attack and stroke. So if we can get those lipids under control, maybe not so much, it's not directly related to weight loss, but definitely improvement in overall health, because it's a major cause of health problems in type 2 diabetics. So it was shown that metformin does help reduce cardiovascular events. We're talking heart attack and stroke. As a monotherapy, it also improved cholesterol or lipids. They also saw, they enrolled people with a hemoglobin A1C of 8 in this study, and lipids were improved. So as a monotherapy, it does see lipids improve. They say they can improve even more if you're on a statin as well. Not everybody can tolerate a statin, but the two together were shown to reduce the lipids that can put diabetics at higher risk of cardiovascular events. So I hope this kind of helped understand a little bit about metformin for weight loss. You always want to talk to your healthcare provider if you think you're having side effects, if you're concerned about side effects, if your medicines seem to be bothering you. And lifestyle changes. We just don't talk about these things enough, especially with diabetes and weight loss. Metformin increases insulin sensitivity. Exercise increases insulin sensitivity. We're not talking big, heavy-duty training for a marathon exercises. We're talking going for a walk every day, doing a small amount of weightlifting. Nothing big here. Small changes in lifestyle can have big changes on your blood sugar as well. But fortunately, there are also medications like metformin that can help. Thanks for watching. I'd appreciate it if you'd subscribe to my channel if you appreciate this information.